Dear friends, I am Dr. Banshi Saboo, diabetologist based at Ahmedabad, immediate past president of RSSDI, and for next year APICON 2023, I am the organizing secretary. First of all, in this APICON 2022, I received Netaji oration, which is most prestigious oration of APICON, and I am thanking Credential Committee, Governing Body, and President and Secretary of API, including Organizing Committee and Scientific Committee, for this oration to me. In this oration, I talked about the diabetes care, where we were. The number of patients in our country is increasing, and the exponentially not only increase in number of patients with diabetes, but they are getting in younger and younger population, and they are getting more and more complications. This is a major challenge for our country. What we are doing in last 20-25 years, we are trying our level best to increase the awareness, to treat these patients early and aggressively to decrease the complication. But if you see the data in last 15 years, nothing is much changed as far as A1C control is concerned. Still, our 2/3 of our diabetic patients are not controlled. With recent IDF data, 50% of our diabetic patients, they are not knowing they are having diabetes, and there is a major challenge for us. Last year, being an RSSDI president, we started a Defeat Diabetes campaign in 100 days to reach out to 100 million persons in India, to increase awareness for diabetes and its complication and how to prevent it. With the idea that can we prevent diabetes completely? Is it possible that primordial prevention can be done? Yes, we are Indians who are thin fat Indians. We have low birth weight baby. With malnutrition and overweight, both in a paradox condition, the mothers develop either PCOD or they have infertility, they have premature delivery and cesarean section, or with malnutrition, they develop in low birth baby. If we can improve the birth weight of a newborn, probably with continuous education, we can prevent these young adults or the persons who are at the low birth weight with more fat percentage to develop diabetes in adult life. This is the concept which we had given a diabetes free India after 2030. Any child born in our country should not have diabetes risk factor in his lifetime, and that white paper we had given long back to our honorable president of our country in 2017. With this, once again I welcome you all for APICON 2023 at Ahmedabad. Thank you very much.